okayfm 101.7.
Mama mi go din komo mesa bam cheme da so K101.7 ni Dr. Dennis Adu-Gyasi PRO the Emma Ghana Association of Biomedical Scientists. Na ye ne ntwetwe komo opani mi moache
ajam bacho mejo so adase
mumpo mu te senso
yesu adom ye mpumu boko arehona akan kakra na nyamete ase ono o ma no aso gie no
ade arewo no arewo no ye nansan na musu se PPE sene niam akade ahodo no emma no eno na ye arewo ana se de ben
enke no kura de uweze se yesu kura ijahim nanso we de ye ni abako a fie da itwa mu no okwa kosra na busuafo no ye adwuma won kan we jagbawe municipal hospital na busuafo Kumasi o mamiensa any 2-month-old baby njaya okosra omo na last Friday okoye no na ne ho ankofa no okoyare ye nti na ne home no ayeden omura se no de no konfa no emergency Jordan opa ene bede jase waye nyamedia yare a ye nyina ye kohu a ye dwen senka ebetimi enya no so nkoni madi no wa hadwen e de enia ba ko no so afrim nti akoye corona ntino ene a me ne okase ya no fa no nkono e wo se ekokra no under supervised barrier ni probably 15 ene be admitted nti ya rehosem ye nyina ye di hobobo asa di suru about the professionals because PPE and you're always adequate. No way to sound the Kahundia. Nanya Wadoma, we edge one of the community knows that.
Mammy, share a dewy. I don't know, Yenumokasa, Yeno. Namu ye complain. Efa Nema Munya, the risk Amunia, the idea, and now more sign crowd statement Abba. Most COVID-19 without expanded testing. Ghana risk further increase in COVID-19 cases. Now, Yamra ewuo no ankasa so far. Adie na mo hwe ya course ema ne ba ye. How was that person exposed to this COVID-19?
A bit difficult to go through this audit, but in March, started enhanced contact tracing and testing. You know, in sample collection. Or side that you can and wasem. And what you know, so no, his contact tracing conform kakra. In fact, I conform kakra into while returning back to his duty post or hospital to say no or routine services. But the Yabeka assessment now. Who say you can't be COVID-19 samples, handle no baby keke. We here biosafety level 2, the minimum. I'll be to handle COVID-19 samples. That is samples coming from COVID-19 patients. But this is something that is very critical. You lack it in most of our facilities. The biosafety cabinet now a hoot. I say Nkuko Bubia. ODBC ABI our lab no baby. Now samples there. I was handle under such conditions, fire na his audio kwako sheho on fra or other samples in the lab because near COVID in Kwana to say you gusu ye wajma there was so many other tests now this facility the brain any and on the koba inti no buchi ne public health reference lab muna na omwitini handle COVID-19 sample yes what the best sign nipa e lab or asia ko kan nipa e hospital for so ama exposure to COVID virus very high because samples are obi over malaria, obi na janai, obi na Johnson. At the same time, yes, here tuberculosis. All these samples, coming from people that we don't even know. Any is an exposure to the risk. And this is how the way very difficult to pinpoint his exposure might be coming from this end because you have several of those Tamale Teaching Hospital, BCU, Begro, BCU, some of them ended up being positive. positive for the infection. Exposure in routine service, is likely to be one of those. In addition to say no your contact tracer or collect the sample.
Mami hwe adewe se covid bi obi ati say mo de hie owu wi a ya omo ye autopsy mo de no omo ye autopsy kan say ampa the underlying cause of death covid.
But a cause of death, I might not be able to say that it's coming out of autopsy, but cause of death that was indicated was COVID. The family has confirmed that. Unfortunately, family per se nema bebre one person on the battery that is already communication krana who could hear say yemfa ni din kra entuka. Said me kan even 2-month-old baby. And said the wife is in so much trauma. Nipa krona nkasa so ne maame ne papa, they are in such a serious trauma. They wanted to avoid so much mentioning of the condition out there. We have a bit of just the information, but the confirmation is clear that it was COVID.
Papa, Mushadin, na krata so a modi aba abonten no dia ne dia ne wom a wo ne ye ewiase nyina beche.
Wom no kakrafa ni jumadi a wodi ho, and in fact he is one gallant soldier. I again say ne ma nyina betwa ono mu jumadi a wodi a, at least they will be happy to say they had a father in such a pandemic, in such a big fight, he played a vital role. And unfortunately, and one acquired there, I don't know, the clergy. The other thing they say, you better not modern. I buy and now say some other packages there. You drink say, you be DHD, they are here who, and moi, you be Niabua, Ama Abushiaso, the people who was a so, you be me, Ama Ahu. Now the tenting is Yamunano, they share Abushiade. The Omodishia or Mafireno, and the Omaja. Any ukuna o mahireno o munshade na nyamena o de ma ono ageno yen se obe prapra o ho ebra ehiemu
mo de krata ba abonte as an association say yenye expanded testing enye sa ye risk of higher increase in COVID-19 cases in Ghana ade ene mo hunu
yo aja de and say apart from non-Noguchi cases here, public health reference lab, you have a Volta region, and public health a war Tamale, and veterinary hospital or Western region. These are the facilities that COVID-19 testing. Into your file sample, irrespective of where you are located, Ghana, it will sample the it will be 3-4 days, 5 days. Now, or hospital. Now you suspect is a bit my COVID. You have sample for that 4 or 5 days, you are in quarantine. Quarantine in the AC and say critically. Some of them may not have the opportunity to say a better other test there because you near to see COVID in Kwanzaa they are so say you will really COVID out. One way and name of you are here empower one town. So at the end of the day, and many Canada who actually waiting for results. And to be brainano, no may be deterred. About how on say, and I'm a cockroach say because me hoyeshi, na me ba hospital, na me rain say in the BC, na me buy a see be detained me be isolated here for 4 or 5 days. Many people will end up there. Facility no cry on my hope you. And the best one, your hospital turn out are follow very, very, very low. We can all go and see the data. It is a nipa. It's so sad we know ma bontia or honor say a COVID. Trevor would be better amount for. And what we have proposed in the say already near woman CBI did tested for TB. Your friend a gym expert. Ya can't watch a mabre. Oka say the year COVID-19 test. Oko talk one no bar. Within 45 minutes, which meanya obia test results. And
Meba obani. Sam komoi yenu wadi machine wo ho. Nim na wo munim ana wo bibi a wo pedi wo baabi enti wo fi ana de
oh aja nkamu amoka say do job nkamu bisaya because president Robert Mutu on the 19th of April in one of his addresses Eka say about 100 of these facilities here were recalibrating here to the COVID-19 test. Inti be seen never say BBC NC Director General Ghana Health Service one of the media briefing, also Bekai, also Yeguso, Yerese Beba. That's a basin level, the year NC on authority. We don't have any gene expert that has been used in this country. Yeah, they tested for COVID. Not a worrying because I know one, cheaper because of the no yet tester is about $20 per test. Meanwhile, the AACC now is about $80 to $100 per test.
Maybe say Obinya COVID no near ye test no a be $80 to $100 per test.
But I test AACC
wow.
Or other places, the cost is about $80 to $100.
And ba kuma e bit na recalibration no e cost to say
$20 per maximum of $20 per test. And the woman say results on no be ma no say PCR no. And no see a real time PCR sa. The only thing they say samples do ubetimo the machines na esisi akese no ebe ye no. Ono no de say we no ye e be 1,200 a day ono no betima ye be 96 tests in a day. But the woman said this is at a district level. And most of the districts will not have suspected cases of about 98 in a day. That's 45 minutes or results compared to 3.5 hours. But what you say? It is far better an option. In South Africa, you should. Mobile testing facility. Screening. You can move.
Machine, who's your friend say?
Gene expert. TB Ghana about 135 facilities Ghana will be even to the district level. This is your use TB in Kwana. Who do COVID-19 test.
Opening na mo letter mo try dey bi mo a mo say the leadership of the professional body expresses disappointment in the lack of commitment from the authorities to heed to professional advice in the fight of the COVID-19 pandemic in Ghana. Say my disappointment our authorities nimu say esse etuhu acheni ni ho our COVID-19 okon aye kun e de ne mo hunu bi ewu
Obani I think say ebia there is no other better word to use and substitute because say what now say a proposal professionally equal advice say adi e bano and to ya na was here to opim see who the first two cases near my yedi kan wasem say the any kwansi cases ya no guchi so nyamencha de omo boae omo bidi mu akotene pa boae senye Japan aban and a cases here ode no guchi e boae and a cases here so Germany through the Bernard Nocht Institute and a scientist and it is set up these facilities are yeah be say COVID by the befahin. None of the Ghana Health Service facilities are buying facility be anywhere from the beginning. Nobody near I can handle some of these situations. It's and the car say yes, a good show must start a good show more. But if you neglect the system, now you are going to expand there, we will have a problem. So look at what really happened. At the point we have a backlog of over 20,000 samples, 60,000 samples, because the system was pressurized. And that way, they can produce a suggestion of COVID gene expert because of one or more machine or about a year who drive it to their COVID-19. This was also proposed. Why can't we move into it immediately? Nigeria, they over 30,000 tests. They received it somewhere last week. South Africa, they started using. So all these things we know about it. You talk and nobody is committed in getting it happen. President Kratuna through the car and that's still BBNC. And yet disappointment now they express I don't know what kind of word we may be able to use. When you did the health system that is not here. On that note, you do a whole have more because about pressure better systems. They say young around here or more testing on the ground. Some of them are not having enough consumables or the bed also more. In the end, one year we may start having the issue of what? Even backlog again. The same cases in Ecuador. I was say, I want there I chance here from March, you let me out also. But SOT, before your easy lockdown, they are almost about 230,000 tests as per the report. But the CIA because from the checks, I just 270,000. And if you easy restrictions are the C and they Yeah, more than 50,000 tests. It should tell us clearly, say, I want the near day testing. That's what it. You need to be a virus on the day, what is what it. They who view into young call life as usual. They are. We may be worried at one point.
Now, more side raise point be say, government on strengthening clinical health and private sector lab, no, so we provide the one more with other. No matter complementary test said the can. Baba Kwana wo can say working committees to say more lab for no. They say crowd the money mu biem na mo hu say the way forward say na mo si kono because mo na mo ye testing no. Eno no eye ba ne say na mo agya meeting dey nyenu an say ya frɛ mo aba no ma ba meeting na mo ko.
Agya ade e wo mpa ne say we say public health emergency be say no eba you put professionals together. You have a very good coordinating system. We are fast. You are here, Drudian, and Yadian, and Fantasy. That you win now, and Shasiano, and see. That's our meetings in them. Confirm the ABA against the Corona and this time, so Magana. But if I see Ghana, no, I in the first 2 cases, no, things were put together. I think we were kind of prompt about it. In any plans I fired a strategic plan Libya Edaho Kratano Eho. You finalize it in 2 weeks' time. I was a week also in 3 weeks' time, in 1 month time, say initiating prepare was here to we document every scene there. Meeting here and contribute. It's the plan I also achieved in milestone for 2 weeks, 1 month, 2 months ago. No, the here. Who be such a meeting? Oh, Minister Akoha, Minister, you say,
Obani. Such meetings, you know, a professionals meeting. Me, a minister there was a
professionals. And they're professionals on ground because, say, Minister, Jane expertise and some professionals are not doing procurement. Professionals will only advise where to go for what, but they should buy it. The budget to raise and who to go and get it from where. And not your professionals, because you can't do that. Spending officers are definitely, trust me, we won't keep talking about it in the radio. But Obi Oha are responsible for procurement. Obi Oha was say, so these are the people you need to meet, and really, as you push ahead, you get to know. But the president cannot say it's not happening now. You are worried because meeting in Koso, Ubisa, and then when there was she say, oh, Debbie, and it's not about professionals. They call it that shot. The professionals, yeah, trust me, in radio or publicity or presser will not be the way out. We would have done it straight away because our money now. It's putting pressure on our people. It's exposing us to greater risk and danger. In the garden, the young conquerors, any was gonna PPE, any any manaba. If radio soon say PPE, we would have had it ourselves because any vampire here, so most of these things go way beyond the professional. Only was a advice in the meeting, finalize, but say. Not possible. The milestones we have to achieve. Task assignment near the identity. It's more of the employment, the employer. It's more of the government. It's more of the spending officer. And if that is not happening,
more as biomedical scientists, more testing. Nagasan, move the air koipa. Muankasano. Mpenifo a ehwe muso no omubu mu
look at disappointment no. And in fact I am
because first time na PPs no akadia ya dey ban I ma musu ho akopim se munipa kura start wuwu ni ade ade e na akwa ba beduru se mukura no mu wo machines ni bia sa machines no mu betimi dia ye Gene expert na mbetimi dia test sa 45 minutes ni en sa kan no kura cost ni $20 per test. The ye ni say $80 to $100 per test. Said what the car can. Na mu kan no amuntia. Ana mu ntamba bie.
Senka Nessa easier. Enga opani ye crache. But I don't know when I will be the next patient. I am in isolation. They try my results because I've had an exposure to a positive case. And you know, me on the results the bana media fire no eba me bobia. I don't know when I will be the next patient. Yen ya will move on Senka Nemko for Akaya doctor for a nurse also can solve because of the risk ahead. Here they are, this is kind of crowd from Friday for Monday or Sudimuno. This calling that we have may difficult, so we take some of these decisions. However, labor law no am I fine. So who say there is a risk ahead of the job you are doing, and the whole say which we have given that caution. But they only say lab no over the years. Yentimi enka yetiri ho aham enti ama ayibone no de omu yiye da but nenu bi ehu sunsanso ne ne yehu ye say you got to the point say the lab was never prepared to fight this pandemic. President could have ye be done and on the all proposal about 88 facilities in the Center for Disease Control there. We only hope say enye kasa keke because there are documents way laid down at that ministry. As and here the Juma, not less than 20 of our health facilities could have been ready for COVID-19 testing. But Montreal, any empathy, a good booty, a Mobeka, empathy at the mobile, young Juma, Moya, Army, Manin, and I have a bit of the We only hope that COVID-19 will be a lesson for us. Let's take our diagnostic sector seriously and apply it because yeah, to talk about this mono. Obia has to be managed over here. Imagine say about there's a baby and ka omo omudi there bi no nke je UG no omoda. Ka say because South Africa, yeah, because America, yeah, because
nyame kire ye bibi.
But kire bibi pa. Kire bibi ba. Yeah, timaya mu na ye mpanyin ko baako from the northern sector. The whole edodo na was a ye helicopter ye ready. Say Fana Bakra 37 Kolebu. But because they needed to stabilize him. Our northern region. It is a good thing say, may have access to a bigger facility, good care, and you may be local ones. And maybe won't be that bigger facility on the other. So it's a calling for all of us there. When we become patients, and for that matter, you may need a diagnostic system. Now we lab diagnosis every healthcare one. Here now they control. A bad trial error. It will keep haunting us, it will keep disturbing us and destroying us. And we think this is the time here. You have more placement to talk about their matters, they have more placement to do their own planning professionally. So that Ghana will have a better place to stand and comparable to international standards. That's why we should let things work, the systems must work. And I think that we have the men that can really run the system. We don't know.
Hello? Hello?
Hello, sir.
Yeah, Doc. Now, how many years are the we don't know, no.
Enquire system, no. Young say, you access to outside. And maybe by a parliamentarian medical screening. Yes, in South Africa, no more. Inti abeda na niya ko Kolebu, abeda na niya ko 37. But yet the any from ISR na asoja for the money to from 37 is one of the public health facilities. Here the first accredited facility. Ghana. What you here? Obi America now or Europe or Germany or here, not by any test to her. Standards now is acceptable, sir, even compared to most other standards outside. But we don't have that accreditation in any of our public facilities. Your money comes from more yet. By 37, they have been able to fence an account. They bought lab for home plan. It's separate from what they are using to buy generator and fuel and building and refurbishing. If the lab will not operate, they didn't say, what buy a reformer? They have the lab with the 80 million, your drasser, lab with the 80 million, your PDA, your Trebe 1 month, your Momecrado. These are all things that you are very young. You keep undermining the lab, and the end effect in it will just go against all of us, our health system.
Doc, you better say, I no pay.
That's what I'm saying.
Yes, I say, you're right.
okayfm 101.7.